Joined right now by Dr. Todd Ellerin. He's the Director of Infectious Diseases at South Shore Health. Doc, it's always great to see you. Let's talk about numbers. Cases continue to surge in some areas of the country. We've now surpassed 150,000 COVID-19 deaths nationwide. Where does that number fall compared to something, for example, like the flu, and why is that so important?
Yeah, so Ed, it looks like the flu is probably 4 times less deadly than COVID-19. Those are rough estimates. But I think what's important to remember is that, first of all, the elderly tend to take the brunt of both infections. So when you look at deaths from both illnesses, it's usually the over 80 group. And then what's really important to remember is that with the flu, we do have that flu vaccine. It's really important, probably more important than ever, that we go out and get vaccinated. Remember, it's not a perfect vaccine, but even if it doesn't prevent infection, it may prevent the severity of infection.
Are people getting numb to the numbers that, we report them every night? Do people get numb to those numbers?
Well, there is this entity called psychic numbness, and what it means is that early on when you hear about initial deaths, that has more impact than when you hear that there's now 150 or 160,000 deaths, and then we'll hear there's 161,000. These numbers tend to get more abstract over time. It probably is a defense mechanism, but I think it's important to remember we don't want to have that compassion fatigue, and we have to remember to keep our guard up.
Dr. Anthony Fauci, he's been talking about trying to reopen schools. PPE, antibodies, vaccines will all play a role. In your opinion, which one is the most important in protecting everybody from COVID-19?
Yeah, that's right, Marie. He did a great Instagram yesterday, and what Dr. Fauci really emphasized was that school openings are really, what they look like is going to depend on how much transmission there is in the community. So if you're in a community with very little transmission, you may be able to go back to class full time. If you're in a hot zone, it may require, back at home type of class, and there may be a hybrid if you're in between. But what he did say is the PPE is really important. The masking, the physical distancing. Now, with kids in particular, it's looking like they don't get hit as hard by the virus. It may be that they have more T cells because they've been exposed to other coronaviruses, and they also may have less receptors in their nose. Those receptors you can think of as like molecular doorways that don't allow the virus in. That's good news for kids.
I want to ask you quickly about these things, the masks. You heard that the congressman from Texas suggest that the virus can cling to the mask, and if they touch it, they can become infected and spread the virus. So what about those full face shields, too, that we see some people wear? Is a face shield better than wearing the mask?
And that comment seems very unlikely and not the likelihood of how COVID-19 is acquired. Masks, if anything, are very protective, both for the user and to protect the person that's near you. A full face shield is probably additive because remember, we still have the eyes as mucous membranes that aren't being covered by the mask. Whether we should all be wearing eye protection remains unclear. I will tell you, in the healthcare setting, it is recommended that we use masks and eye protection as well.
All right, Dr. Todd Ellerin, South Shore Health. As always, we appreciate your guidance and your expertise and your insight, and we say,
Thank you, guys.
Be well.
Thanks, Doc. Be well.